More than 14% of Canadians don't have access to a family physician for regular care. That's just one of the stats in a new report published in the Canadian Medical Association Journal that highlights a system that isn't light on spending but is coming up short on results. Dr. Tara Kiran is a family physician and a researcher at St. Mike's Hospital and the University of Toronto and author of this report. Thanks for being with us.
Thanks, Amanda.
So let's just start with the shortage of primary care physicians. We know that from the world research that is the fastest way to keep people from being sick, and it's the most cost effective. So how long has this problem been going on that got us to the point where so many Canadians don't have basic coverage?
People have been struggling with accessing primary care for a while, but things got worse in the pandemic with early retirements and fewer people choosing to go into family medicine. And the latest stats actually show that it's more than 1 in 5 people in Canada, or more than 6.5 million, who don't have a regular family doctor or nurse practitioner who they can see.
And so where does that lead us? In other words, is the health of those people at risk? Does it put additional strain on services like the emergency rooms? Where do they go when they don't have access?
Great question. I mean, it's heartbreaking because family medicine, primary care is the front door to the healthcare system. It's where you're supposed to go to stay well if you have a chronic condition that needs to be managed, but also, of course, if you have something new that comes up. And for all of those things now, people have nowhere to turn. Family medicine is also where they coordinate other parts of the healthcare system. So yes, we see people trying to get that kind of care in walk-in clinics, sometimes going to the emergency department, sometimes even just like trying to do what they can with friends, families, websites, contacting people overseas. And ultimately, those things are not meeting the needs. And so it's a real problem. People are being left in the lurch.
Is this as simple, doctor, as just training more physicians? And while we're at it, we could add nurses to that. We know there's a shortage. Why don't we just have more people in school training right now?
Yeah, so in our study, we actually did look at compared the number of physicians and number of family doctors and per capita in Canada compared to other countries where almost everybody has a family doctor. And Canada does have around the similar numbers of family doctors, but lower numbers of physicians overall. So I think some of the equation is actually training more physicians generally. And so what happens here in Canada is some of our family doctors end up working in other parts of the healthcare system, like hospitals or emergency departments. And so we need more physicians, it's true, but it's not as simple as that, because what we need to do is actually rethink the way we work and build a system where physicians are able to manage more patients. And the way to do that is by expanding team-based care. So having doctors working with nurses, nurse practitioners, pharmacists, social workers, so that their expertise can be extended to help to serve even more people. And
I mean, on that front, that sounds like autonomy to doctors, which doctors would welcome. I would ask whether we should actually be demanding more of doctors and saying, you have to spend less time in a hospital, for instance, and more time in primary care. At the moment, they can choose the mix, and that might be leaving us short at parts of the system we can't afford to be short.
That is such a great point. So the other countries we looked at, they definitely do have more accountability for physicians, including what kind of scope of work they do, where they work, what hours there are. Right now, doctors are small business owners and they have control over their work setup, including what type of practice they do. But at the same time, we also know that many new grads actually don't want to be small business owners. So I think that we actually have a window of opportunity where we can say, okay, look, here, we're going to provide the infrastructure and some support for new people to do family medicine. But we're going to trade off some of the autonomy you might have if you were doing running a small business family practice. So I think there's an opportunity right now to try and have some more accountability, but in return, potentially for some supports and a better work-life balance.
So good to have you here, Dr. Kiran. We appreciate your time.
Thank you.
Dr. Tara Kiran is a family physician and researcher at St. Mike's Hospital and the University of Toronto. Time for the takeaway and throwing good money after bad. When it comes to healthcare in Canada, most Canadians have a sense of frustration. As much as we take pride in its universal, publicly funded nature, the system isn't working when so many of us can't access even basic primary care. And the wait times for life-saving procedures are often longer than not only optimal, but even humane. So what to do? As a line item in our government budgets, spending on healthcare is only set to expand over time. The population is growing and it's also aging. But as study after study shows the disconnect between what we spend and what we get, it's past time to look at the problem differently. We spend more than other nations who are doing better for their citizens, so maybe more money isn't the answer. Some of the issues we face, like straight-up staff shortages of doctors and nurses, are fixable with some minor changes to how we regulate and run the system. But bigger picture, this ailing infrastructure may need a total redesign. Anyone who's ever tried to renovate a dilapidated structure will tell you that in the end, it's often better and cheaper to tear the whole thing down and start fresh than work around a flawed base, and not to let nostalgia or a false sense of your sunk costs keep you from that best course of action. Our system is definitely rotten, but where will we find the political will to tear it down? One path to finding that fortitude is sheer necessity. We simply can't afford to go on as we are. If we don't make some changes, we'll run out of money in our tax-supported budgets for anything but funding a system that doesn't work for too many. My takeaway? Instead of patching over the problems of the existing healthcare system, let's take a hard look at fresh blueprints and find the courage to knock it down and build something better. That's Taking Stock for this week. I'm Amanda Lang. Thanks for being with us.